I'm bringing it out from an academic perspective, from a public health perspective. When I think of how mothers are the base where we are developing these families, we are growing these children. So we need to be able to take care of ourselves in order to be able to continue to give in the way that we are maybe wanting to give.
Hello and welcome to this week's episode of the Motherhood Made Magic podcast. I am your host, Anna Cusack, and today I'm speaking with Dr. Haya Zedan. She is a mum and advocate for mental health and wellness in Saudi Arabia. With a background in psychology, public health, and primary care, she teaches and conducts research at university in the areas of health, law, politics, and ethics, health behaviour, maternal, mental health, and e-health. She's a perinatal mental health counsellor, certified by Postpartum Support International, a certified motherhood studies practitioner, certified women's wellness and childbirth educator, and a certified lactation counsellor. She is a writer and lifelong learner and believes there is untapped potential for women to thrive in themselves and in their motherhood experiences. Welcome, Haya.
Hi, Anna. How are you?
I am very well. That's a really impressive introduction.
Thank you. Thanks a lot. It's really nice to be here with you today. So thanks for inviting me.
How did you come to be in this line of work, in this whole space of motherhood?
So, I mean, it's an interesting question. You never actually think about, how you walk into something like this. I think it's just something that naturally evolves. I've been a mother for about 17 years now. Many of us, we start off, we start having families without any kind of conscious decision that we make. And it changes you on so many levels that you don't really expect. And I've always been interested in sort of women's studies and, sort of family. I come from a very large family myself, very closely connected, but I never actually realized how deeply motherhood changes you until I was actually in it. And, it's just something that naturally evolved. When I was at university, I was always interested in sort of psychology courses and sort of behavior. And, then I did a psychology degree, and then I did a public health degree. And then I realized how much that was important to me because of the fact that I had actually, sort of become a mother, and I was taking care of a child, and sort of what life we were living, and how important it was for me to do that right. Okay. Now I understand that what's right to me might not be right to others. So that widened my perspective. And I realized that my experience as a mother might not be the same as any other woman or any other mother. So I started to explore that a little bit more. And so the experiences of pregnancy are so different, even from one experience to the other for myself. They're never the same, are they? It's just so fascinating. And I just wanted to go sort of and go into that a lot more. And so I've just been letting it evolve, really.
Come to this space with a really interesting blend of really scientific study, academic focus, and then also this kind of holistic care element in your practice as well. How do they blend with your clients, and do the disciplines actually, I'm guessing they sort of clash more outside of you rather than inside of your work?
It's been a process to get to this point, because it's something that in this space I did actually spend a lot of time thinking about, because I have a lot of skills, a lot of different skills, a lot of different interests, but I wanted to see how it was that I could make them all work in a way that would produce something valuable. Okay, so I'm a mother myself, and I've always been interested in research. I'm an academic. I teach at university. I interact with students a lot. I develop curriculum, programs, courses. I enjoy that. So how is it that I'm able to fit what I've learned with what I do, with what I experience every day as a human being? And I found that this was a really great place for me to be in, because I love this. So in that way, I was able to make it align. And I realized that there was a need for this. in this space, because there are so many women who start off their motherhood journeys without that kind of awareness that we actually really need. Why am I becoming a mother? What it is that I can do to be able to thrive in this space. That is really important to me. It feels like something that I can add value here. Maybe if I share my own experiences, it will help others to see how much more potential there is and what it is that we can do to support each other. Because I went through some of these experiences without that awareness, and I really struggled. And I would like to be able to say that I be able to support other women to not struggle so much.
That's a theme that comes up a lot for women in the Western world who embark in the world of motherhood support. Is it something that's new? Are you a trailblazer doing this kind of work in Saudi Arabia, or is there a collective of women doing this kind of work with you?
I think there are a lot of other women who are doing work in the area of motherhood and birth and parenting and child rearing, but I think every single one of them brings in her own unique flavor, shall we say. I wouldn't like to say that I am a trailblazer. I know that that's a thing where, people always want to be the first to do something. That isn't something that directly concerns me. What it is that is my own experience and my own perspective and how I can bring that forward. That's what's most important to me. I really feel like I can add something here. And I do feel like it's a perspective that might be unique in that way. Okay, is that I'm bringing it out from an academic perspective, from a, shall we say, a public health perspective. When I think of how mothers are, so the base where we are developing these families, we are growing these children, we are taking care of them, but we should be taking care of ourselves as well, so that we can continue to give in that way. If sometimes I liken it to sort of like a mobile phone, like a device. If you're not plugged in and you're not charging fully, okay, you're not going to be able to operate at the capacity that you should be operating at. You're going to keep shutting down. And that's not healthy, and that's not good for us as mothers. So we need to be able to take care of ourselves in order to be able to continue to give in the way that we are maybe wanting to give.
I like that you say wanting to give, because we do want to give. There is an expectation that we will give, but there is also a want. It's not all what we're pushed into or default. Like, we're coming to this as creatures of love.
That can be really conflicting, because I think it's, on some level, it's instinctive, but on another level, there is a lot of that sort of social expectations around you of what a mother should be doing. And that's where I might come in here with a different perspective. In sort of the space where I operate, there's a lot of that expectation of that mothers should be selfless, they should be giving all the time, they should be sort of not concerning themselves, they should be just, sort of continually putting themselves out there and sacrificing, and that sort of martyr mentality. And it's something that I would like to maybe challenge a little bit and say that it is, great that we are able to continually give, but we have to give from something, and therefore we do have to take care of ourselves. And that is more than reasonable, I think. That it's not just something that we are striving to do for others, but it's something we have to be full ourselves to be able to continue to give.
We often speak about the idea of the perfect mother in Western motherhood. And you and I have both studied with Dr. Sophie Brock, who really explores this in great detail. What is the characteristic profile of the stereotypical perfect mother in Saudi Arabia? Because the image that I think would spring to mind of women in Saudi Arabia for a lot of listeners in Australia is probably quite far removed from your lived experience.
There is a lot of similarities. I think this is something that we found out and we were quite surprised by when we were in the course. There's a lot of similarities to, sort of how mothers, mothers like me or mothers who are living in this sort of society or this sort of context are, that really do overlap with a lot of sort of the Western expectations. We are expected to give continuously to our children, to be available all the time, to understand their needs without having to struggle with this, to be able to always understand what it is that they want at the moment and be sort of always proactive, always engaged, always taking care of their every want and their every need. And at the same time, to not complain, to not need help, to be able to do everything. We do have this sort of culture of the super mom, Wonder Woman, that, you'll be able to do everything and always keep a smile on your face. And I think this is something that needs to be addressed. I think it's something that we need to talk about a lot more. Why is it that we put so much pressure on mothers to be perfection? Okay, to be always ready, always available, always smiling, always happy, always engaged, and not think about sort of what it is that goes on behind that. And we've talked about sort of that mask of motherhood. I think that was really powerful concept. There's so much more depth in what a mother actually is than we do see. A lot of this is invisible. And that's something that I recognized, is that a lot of these mothers are actually really struggling. I'm struggling. But I'm struggling. I don't say that I'm struggling because it feels like it might be something that's shameful, that I should be able to do all of this without complaining, that I should be able to understand what it is my child needs without them being able to talk to me if they're very young. If they're crying all the time, I should be able to soothe them. If they are not eating, I should be able to overcome this and be able to feed them and keep them healthy and keep them strong and keep them happy. And if I'm not able to do that, then that makes me feel like there's something wrong with me. And that's very damaging, I think, because nobody knows what they're doing. And that's, I think, one of the best kept secrets in the world. Nobody knows what they're doing. Okay, and every single one of us is doing her very best at that moment in time. And my best in the morning might not be my best out in the afternoon or my best at bedtime. I think women are amazing. Mothers are amazing, but they're not superhuman. We are very human. Actually, we are, I think, more in touch with our humanity than any other. We've gone to the depths and we've come back. We know what it means to be alive and connected to, these children that we've brought into the world. That makes you realize and respect what it is that you have, and understand that what I might have might not be what other mothers might have, and vice versa. Okay, so it's very important for me that I'm conscious of this, and I don't judge any other mother the way I might have maybe years ago. Okay, because I recognize that every single one of us has her own capacity and her ability to mother in the best way that is her way for her children. And I honor that, and I give them the space to be able to do that. So when I talk to other mothers, it's me being able to offer them that safe place that, you can say that you're struggling with this, and that's okay. There's no harm in that. But where can we go from that? That we can build up your strength so that you can continue to do what it is that you want to do. Every single thing that we do is a choice. And I think that's a realization that women have to come to. We choose to not eat breakfast, okay, because we want to be doing things for our kids. But it's okay for us to make a decision to say, okay, I'm going to take 2 or 5 minutes to eat something, okay, that keeps me okay, that keeps me happy, that keeps me healthy, so that I can continue to do that for my kids, right? That it's okay for me to do some kind of physical activity, to do something that brings me joy, okay? To rest, okay? I don't have to be continually doing for others. Yes, I can rest because that's part of me taking care of myself so that I can continue to give to my family. I think that's really, really important because we often push ourselves so far that we collapse.
Does this come through, this theme, in your public health research?
Yes, absolutely, it does, because this is what happens. And this is really important to me because I have this background. I'm very interested in health policy, public health, quality of life. It's really important for me to understand. And let's say if we don't take care of these issues at the start. We don't build this awareness in mothers. We don't build this awareness in society that mothers actually shouldn't be doing everything all alone all the time. Okay, because it does lead to sort of mental health issues. It leads to a lot of social issues. It leads to this collapse, I think, this breakdown of relationships between mother and child, because I can't do this anymore. I don't want to do this anymore. I'm struggling mentally. I'm depressed. I have anxiety, all of these issues. And if we don't take care of these early on, they're going to spiral. And what happens is we lead to this collapse where mom needs to go to the emergency room, she needs to be hospitalized, she needs to be on medication. And this is part of the thing that, I'd like to challenge, saying that it doesn't necessarily mean that if you're struggling that you automatically have to go directly to medication. You don't have to let yourself go to that point where you actually do collapse and you need hospitalization, okay? And therefore, I bring it into that sort of health policy avenue, saying that we don't have the capacity in our healthcare system to hospitalize at this level. Okay, we don't have, shall we say, enough trained psychiatrists in this area. Why are we letting it go this far then? Okay, that's why I'm bringing it out from a public health perspective, saying that this is a very important issue. Maternal mental health is a very important issue. If we can do more for it early on, we can prevent the social effects, we can prevent the effects on the family, we can prevent the effects and the impact on the healthcare system itself. Okay, bring it back earlier into that awareness of what does it mean to become a mother, this concept of matrescence, understanding the expectations versus the reality of motherhood, building up the strength in the mother herself to be able to go through this experience with that potential to thrive. Yes, it's great. I'm going to be able to do this because I have the knowledge, I have the power of what it means and how I can do that with strength, and therefore reduce the risk of developing many of these issues like depression or anxiety or otherwise, okay? Reducing the risk significantly, okay? Being educated about pregnancy and childbirth and how it's going to impact me, okay? Builds up their resilience, builds up their potential to thrive in this experience, right? And therefore reduces the risks that will come down the line. It just makes sense to me.
It makes perfect sense. It makes perfect sense. And it's the conversations that are happening around the world and have perhaps not been listened to for a long time. But it sounds like you're talking about, we just need to build the fence at the top of the cliff instead of putting the ambulance at the bottom of it.
Yes. That's what I'm saying. There's a quote in the book Untamed by Glennon Doyle, which really, really struck me. And I've seen a lot of people talking about that quote. It's saying that there's a lot of people who are drowning. Well, it's not just pulling them out of the river. It's going back up and seeing why are they falling in the first place.
Exactly right. Yeah. And it's well worth a read for anybody who has not read that.
It's really, really an awesome read.
While we're on public health, what has the experience been like for you as a mother of 4 with quite a broad range of ages, somebody who works in a very high position during a pandemic? How has your experience been different from perhaps your colleague who may be a father of 4 rather than a mother of 4?
Yeah, that was really powerful. I think the experience of mothering during a pandemic was something none of us would have been able to expect. It came on really suddenly, and it shifted the way that we ran our daily lives. Okay, first and foremost is this idea of remote schooling, because it really came down to the mothers having to monitor how the schooling was done and taking on more of that responsibility. So I teach online anyway. So in that respect, what I do in sort of my day job didn't really change. But it was the fact that it was concurrent with the kids being online as well, and having to keep an eye and having to sort of do more than one thing at the same time. That was a challenge. And that's something that we adapt to quite quickly. but it can lead to burnout because nobody can operate like that sustainably for a long time. We expected it would be a few weeks, right? And okay, I can manage this. I can pull myself up. I can continue to do this. I can continue to give the energy that they need to be able to do this, to be able to keep them motivated, to be able to keep myself motivated. So I did that for a while where, I would wake up extremely early in the morning before anybody would start classes so that I could do sort of a lot of the administrative work that I need to do, or to do some of my writing or something. But after a few months of that, it wasn't sustainable. I couldn't do it anymore. I started to get tired. And there was a lot of people, I think, who were going through similar. So I started to reach out and say that, okay, let's do something how we can support each other. Okay, instead of me having to struggle with this by myself and you struggling with this by yourself, let's try and do this in a more community-oriented way. I'm saying that, actually, this isn't working for me. I need to be able to dial it back. Yes, maybe I had goals for 2020, but I wasn't able to tick all of them off, and that's okay. Okay, and I recognized that it was a day-by-day thing. I'm not going to be thinking about a week anymore. I'm going to be thinking about what it is possible for me to do today. And this is something I think that has actually come out, that no matter how advanced a society might think it is, or how much equality there might be, actually, when it came down to pandemic living, we reverted very quickly to the mother being the primary caregiver. No matter how evolved anyone might think they are, even in the Western world, it really quickly reverted to moms doing most of that, most of the childcare, most of the schooling. There are unique examples, I think, of fathers taking on and sharing some of that burden, but I think generally speaking, it was the moms that took on that responsibility.
Yeah, there was a study conducted in May 2020 during lockdowns in Australia by researchers Lynn Craig and Churchill, and that showed that amongst couples who were both working full-time hours, the mother was taking on, it was either 15 or 21 extra additional hours a week compared to the father when it was in lockdown conditions like that, showing of even may on the surface appear equal, both working from home, both around the children the same amount, that's just not how it was playing out. You probably have seen it in the academic space as well, that the quote from one of the editors of one of the major journals, perhaps you remember which journal it was, who said that she'd never seen anything like it. The amount of single author female publication submissions just dropped to a negligible amount.
Absolutely. There was a lot of research on female academics and how they were handling the pandemic and how it was affecting their career progression. That's something that I'm really interested in, and that I've sort of worked on personally, supporting a lot of my colleagues, my female colleagues, in trying to sort of keep the pace, but not at a rate that would affect them sort of mentally or emotionally, because we put a lot of pressures on ourselves to excel and be perfect and keep doing what it is that we're doing, and really struggle through it, and saying that, okay, it's good to have goals, but it's also really important to take care of your health. Helping a lot of them put together like personal research strategy plans, saying, okay, this is what I want to be able to achieve. How can I scale it back in a way that doesn't affect me or my health or my relationships with my children or my family, but still allow me to feel like I am achieving? Okay, yes, the pandemic might have slowed us down. It might delay, and that's a fact, but it shouldn't be something that, affects me negatively, affects me and my mental health negative. It's really, really important. So the online schooling with kids, okay, it's great for us to be able to keep them engaged, to keep them learning, but it's about the learning. It's not about the numbers of hours that they are attending school or the number of homework assignments that they submitted. It's not about that. We have to keep the focus on, why are we still doing this? Why are we having them, sort of online at school and not just at home doing nothing? It's because we want them to continue to be able to learn, right? So that was a big shift for me, saying that, okay, as long as you are learning the content Okay, that is what is most important to me. It doesn't matter to me if you attend the full class, maybe you can attend half of it, and we can spend time sort of making sure that you understand the lesson. That's what was most important to me. It wasn't about fighting with them, about sort of spending exactly the number of minutes. It wasn't about that anymore. So it really changed my perspective.
Yeah, and it's where your values lie that come out when you start going into almost recognizing that you're in survival mode and going, okay, what is important to me? What am I going to keep and what am I going to let go of? And I think that's reflective of a lot of motherhood in general.
Pandemic really showed us what was important, made us recognize that, yes, it's great to have all of the other things, but actually when you're put into a situation like the lockdown situation, you quickly recognize what it is that you really, really, really do need and what it is that you can do perfectly well without.
One study that you've been working on recently, you've mentioned to me before, and I would love if you could elaborate on that process a bit more around the experience of birth and specifically birth trauma. Could you explain that for us, please?
So that is something that's really interesting to me. I've had lots of different experiences myself. I've had 4 different experiences. Each one of them was unique. Some of them I consider to be now, in retrospect, have been traumatic. And I know that there are so many women who go into pregnancy and birth completely unprepared, as I was unprepared at the beginning. And I recognize now as an academic that I've done sort of my research or my homework into this area, and I recognize that there aren't any studies here that specifically look at the experiences of women in birth, the sort of psychosocial aspects of birth. There are studies on birth injury, physical injury, but not in the mental health space. And I think that's really, really important because a woman never forgets her birth experience, no matter what kind of experience it was. And if it was a negative experience or a difficult experience, that stays with her. It can affect her really deeply. It can affect her ability to enter into that motherhood space, her ability to take care of herself and to take care of her children after that, her relationships with her children, her relationships with her husband, her relationships with people around her. It's really, really important for us to flag this and to make it more visible, saying that it's not just about the woman not dying or the baby not dying during birth. We mainly focus on the mortality statistics, but it's so much more than that. I think the focus in healthcare now is to just make sure that the mom is okay and the baby's okay. Okay. And a lot of it, I think, is maybe gaslighting the mother's experience and saying, well, at least your baby is okay. No, that's not enough. Mothers deserve more. We deserve to be able to go through that experience with strength and to actually enjoy it. It is possible to actually enjoy your birth experience. But that, if you say that here, people are like, what are you talking about? That's impossible. Nobody enjoys their birth experience. Birth is difficult. Birth is troubling. Birth is an emergency. It doesn't have to be that way. It can be a joyful experience. It could be a spiritual experience. And mothers deserve to be able to experience that in the way that they were meant to. So if you that's something that we're working on now, that I want to be able to go in and explore that and talk more to mothers and see what kind of experiences they're actually having and bring out some of the evidence that we can talk to maybe healthcare providers and maybe change some of the way that we are approaching birth, maybe something that is more trauma informed, more respectful, giving women more of a say, more of an active role in their birth experiences. Maybe even adjusting health policy to be able to accommodate for that and to really recognize the long-term effects that the birth experience does have on the family and therefore the society.
Because really, if our families are essentially held together by the mother and the communities are put together of the families, it comes back to her well-being over and over.
Absolutely. I think that is the base that we need to operate from. That's why I think of it as the way that I am combining my experiences, my sort of psychology background. I'm training now to become a licensed psychologist. I'm certified as a perinatal mental health counselor, but I'd like to certify as a psychologist to be able to explore this area more, this sort of maternal mental health impacts, sort of that post-traumatic stress disorders that women might go through, how that's affecting their ability to breastfeed, their ability to connect, to bond with their babies, to be able to really, really go into that motherhood experience the way that they deserve to be.
And that will be a really beautiful gift for every woman and mother that you come into contact with. You're just so passionate about what you do and you have so much to offer, and I'm really excited for what the future holds for those families that you are able to work with.
It's going to be sort of a few years in. It's going to take time for me to do it. I know that I can't do it myself, and that's why I put myself out there and I talk about this, because I want more people to be able to work in this space. And like I said, every single one of these women who work in this space, they add value, and the more that we work together, the more we are able to achieve.
That's it. It's one of the very few spaces where it's not competitive. It's just everyone giving the same leg up.
Yeah.
Thank you so much for speaking with me today, Dr. Haya. Where can we find you and connect with you?
I really appreciate the opportunity to sort of be on the podcast with you, Anna. It's just so valuable to me. I'm on Instagram. My handle is @Maternal Wellness KSA. So I'm really happy to be able to connect with anyone who likes to sort of or wants to be able to explore this area of women's health more. And it's an honor for me to be able to work in this space.
And a lot of the content that you post both in English and in Arabic, which is important too.
That's really, really important to me, because there's not a lot of content that's available in Arabic. And to be able to support women to sort of learn about motherhood and, how their expectations might conflict with the realities is, really, really important to me. So
thank you very much. And I'll speak with you soon.
Thanks, Anna. Take care.
Thanks for listening. I hope you love this episode as much as I loved recording it. If you wish, you can subscribe and leave a 5-star rating on your podcast platform. And if you love my work, please be sure to follow along with me on social media @Anna Cusack Postpartum on Instagram and Facebook, and grab my book from www.annacusack.com.au/book. Until next time, bye.